The next part of our work is on the workshop is on search strategy, and I'm Dr. Bharat Modi, who is going to present the third part of the workshop. So let us go ahead and find out how to search. Now each search will need to have a strategy. If you are going to use PubMed, then you have to use this strategy which is responsible for training. If you are doing OVID, then Levian. So whenever you want to start something, you have to start at the very beginning, and that is, if you are in singing, then it is Do Re Mi, Sa Re Ga Ma Pa. But as far as evidence-based education system is concerned, the first thing which you will probably want to do is find out what is the category. So it is therapy, diagnosis, prognosis, or causation. What is the technique, what is the intervention you are going to do, what is the efficacy and efficiency, that is a therapy question. What test you are going to use, whether it is good or reliable or not, that is diagnosis question. Patient likely to, what is the likely effect on the patient is the prognosis part. And what causes the disease, that is the causation part. So each category will have its own different method of searching, and it will have its effect that much more different. So let us take an example of an adult patient who smokes 20 packets of cigarettes, and he's come for therapy question. Patients, which is the aim is to he should quit. Will the introduction of chairside counseling for my adult patient who smokes help the patient to quit smoking? Now this is a question of therapy. What are the oral sequelae of smoking? That is causation. How will quitting alter the risk of question? That is prognosis. And how will implement the program affect financially? That is the economic question. So this category, the problem is the same, but it has different category. The 5 A's of EBES are ask, access, appraise, apply, and assess, and that is what EBES stands for. We'll go one by one so that we know how to search. The first one is ask. You have to ask the right question, have the right focused question to be asked. The important thing is to ask, and because the curiosity is what is going to make it exhilarating. A well-crafted question guides the systemic planning, and most research questions are too broad-minded. So you have to limit, you have to narrow it down, you have to limit that. And search strategy is nothing else but using this focused question to search for articles, and then you narrow the search so that you don't have too many articles to read, because there is no time for reading that much amount. So precision is important. So there are two types of questions, background and foreground. Background will be a general review of the topic and best answered with the review articles. Whereas a foreground question is something which you want to go ahead do a kind of a research question. So you have the focused clinical question, and then you have to go for original research paper. So there are two different parts which is there. Background is something for knowledge, whereas foreground is something which you want to find something new. So in a patient aged 39 years reports with a chief complaint of dryness of the mouth, and then probably drug induced. So the background question for the same would be what causes xerostomia? How are xerostomia patients managed? What are saliva substitutes? What are saliva stimulants? All this will be found in textbooks or articles. Foreground question, on the other hand, compare one type of saliva substitute with another, compare one type of saliva stimulant with other, compare a stimulant and a substitute, and you will have to use BICO. So for that you will need to go for systemic review or something else. The next part is access. Access means that where you have to search. So you need to go for some database, whether it is Cochrane, Medline, PubMed, EBES, TRIP, OVID, Scopus. There are so many different databases available, and you could go for any of these for your searching purposes. And that is where you will find all the necessary evidence which is required for going ahead with your patient management. So best thing would be PubMed, because it is the most easiest thing to do. So you need to have Boolean operators, and this Boolean operator is either or AND. So bad breath or halitosis. So both are meaning the same. So but if you add or, then you will get articles both of bad breath as well as halitosis. But if you combine, say, bad breath and toothbrushing, and you write and in between, then it will, what is common between two, only that will come out. So you formulate your PICO question, develop a search item, guidelines and summaries are to be certain, and that's why you go for different websites. Once you get your matter, you stop the search. But if you don't get the matter, continue your search from one database to another, depending on how much volume of articles you are requiring. And that is why you need to develop that particular strategy. In fact, for systemic reviews, the search strategy becomes a very important matter when you are writing a search. You have to use mesh headings because alternate terms will be there. Specific words will be there for words, alternate words will be there, truncated words will be there, negative words will be, connotations are there, and or could be utilized as a Boolean query. So you have tumor, then you have benign, malignant, neoplasm, cancer. All these are similar to the tumor. Child, when it is with an asterisk, means children, young adults, all those things. So in mesh there are four characteristics: heading, subheadings, supplementary concepts, and publication characteristics. These are in the form of a tree, where a tree has got the trunk, and then they have branches, and from the branches you will have leaves. Similarly, you have headings, subheading, supplementary concepts on that. For example, in the headings, body weight is also means body fat. Kidney means renal. Dental cavity preparation is class, also one part of it is class 1 cavity. Self-medication, OTC drugs. Radioactive waste, isotope waste. Brain edema, cerebral edema. You have to know the alternate terms. So dental cavity subheading therapy include all articles on cavity preparation, includes diagnosis, form of preparation, procedure. So what exactly you need, you have to filter it down. If you are interested only in the finishing and evaluation, then you write that after you write your dental cavity, so that your there is a limitation. You don't get other articles which you are not interested in. For example, amalgam, other fillings will be composite and GI, inlay and onlay, sandwich technique. So you need to know the different terminology. The body weight will also have lipid mobilizing drugs, liposuction, weight loss, bariatric surgery, side effects and harms also could be included. So you are limiting yourself only to side effect and harm, not on the treatment aspect of it. So using mesh is very important. So and then you get the publication type. The publication is going to be letter, review, systemic review, or randomized control trial. So you have to decide according to the pyramid of evidence. You'll have to choose which one is the best. So body, as I said, it is a tree-like. So you have anatomy, body regions, head, and then comes to ear. Ear can also be further divided into external ear, middle ear, inner ear. So as you can see from the trunk, you have gone to the branches, you have gone to the leaves, and probably the fruits out there. So this is how mesh headings work, from one to the another, and you will have to follow that so that you are getting something which is only specific to what you want. So there are about 4 lakh words linked to 20,000 headings. Now for example, post, if you write, it could be stress disorder also. It could be or it could be traumatic as far as endodontic post is concerned. So depending on what you write, you will have to be very specific. So, and you have to whether you want abstract, whether you want text word searching, that you have to decide. Now you have to keep on combining searches, and for that you will need Boolean queries like AND. Head and neck cancer and quality of life. If you combine that, you will get only those articles which are on head and neck cancer and quality of life. But if you write or in that between, then you will get all the articles on cancer, whether it is surgery or whether treatment, chemotherapy, radiotherapy, everything will come. But it will not come on quality of life. The quality of life will be something different. So when you combine this, you are focusing. Or will means you are exploding. So you will get both the articles exploding. Not is also limiting. So methodological features filters can be also used. Therapy, diagnosis, etiology, prevention. These can also be done. So fluoride and caries and geriatrics or agent will give you specific something about fluoride and use in caries. So the search concept is something which you need to know, and only then you will be able to do it. The Medline, which is the US National Library of Medicine database, has got so many citations which are there. More than 16 million references are there from 1950 onwards, and currently there are 5,000 journals, 37 index journals, and probably it will be more by the time this comes to you. So it's a huge database, and that is why your search strategy should be such that you are able to utilize that search for your patient, and that is the most important thing, because all this searching exercise which you are doing is for the patient. So patient should help. EBES is another one which is good, published by Elsevier. Again, it has got 12 million records from 1974, more than 4,800, and 13 different languages also. And these are the websites for that. So what is the searching process? How do you do the searching process? Let us go ahead and see what can be done. So then there are very different databases which are there other than PubMed and Medline and EBSCO. Now the number of articles which are coming out are in biomedical, Medline and trials are tremendous. You can't keep up with that, and many of them are having bias and confounding. So they have to be eliminated. So this elimination you can do only after reading. So you do not have the time to do it. So does it mean that it is mission impossible for us? Can we not go ahead and use evidence base for getting ourselves updated? Yes, we can definitely do that. Now which kind of doctor you are? Somebody like William Osler, who was in 19, or a smart young doctor who's computer savvy and doing it. Probably what you will be probably wanting is that there should be a total merging of these two. You should have the brain of William Osler and the ability of a young doctor. If that is there, then probably you will get both a wise and experienced smart young doctor to treat yourself. So that is where evidence base comes into picture, and that is why if you want lifelong learning, then as William Osler himself said, the hardest conviction to get into the mind of a beginner is that education is only the beginning. The whole life you will keep on learning a lot of things, and you will need to learn a lot of things, because changes are taking place at very rapid rate. Technology is improving in such a rate. So asking questions, background questions to get your knowledge base sound, and then go ahead and do the foreground question. So a question which asks who, what, how, when or why is based on background. A disorder or specific aspect of a disorder, if you want to know, then that is it. Now the key concepts are: identify the searching concept, enter the terms of that key concept. Automatic suggestion will come from PubMed and all those places. You can also turn it off if you don't want it, and then click search. This is the process which you will go ahead and do it in PubMed, and that is what you have to follow. And when you do that, all the knowledge will jump out of this, and it will be on your fingertip. That is the advantage of having evidence base. Now, for example, this is the front page, and there is a box where you have to type the word which you want to do it. Once you type the word and you click on search, then immediately once you do the search, it will give you other options. So caries can be also dental caries dental or root canal. Then after you do the searching, then there are so many tools. You can use clinical queries from the choice, or it can be used in a drop down menu, and then choose whether it is therapy, diagnosis or etiology. As you can see, the category selection is there. Then the scope of the category, whether it is narrow or whether it is one broad. So that PubMed helps you to narrow down to particular specific, depending on what you have typed. If you have typed properly, then PubMed will help you a lot. Then now you would probably want to save your whatever search which you have made. So for saving in PubMed, you have to do is signing. For example, once you get the articles, as you can see here, there are more than 69,000 articles which have come. So you have to save the search, and for saving search, either you can do this, or you can go in a drop down manner, and you can either do it on clipboard or another play, or you can load it there for offline reading later on. So, and it can send you back also. Now the results are shown in this particular format. So you have the articles, authors, then you have the journal, the year in what published, and the pages, and you have whether it also tells you whether it is in process or it is already been published. So that when you click on the title, you will get an abstract immediately. So search results, when you do that, so for example here you have done the search on burnout professional, you are getting 5,588 results, and these results are then displayed. 20 articles on one particular page is what it is given. Now you will have to start narrowing it. So what is the type of article? So if you want meta-analysis, then you have to tick on meta-analysis and then click search. So you will get everything which are meta-analysis. So now you can see the articles are only 196. Now then you want to do is if you want to limit yourself to clinical trials, then you can do that. Or if you want to change your search engine, then you can change and remove also. So all that you can go back also. So meta-analysis, randomized control trial and clinical trials, if you do, your articles from more than 6,000 have come down to 196. Now if you are, if it is randomized control trial is a publication type, then in that case you have, and it is a research supported article if you want, then you get only one article, and that is exactly the thing which you are looking for, reflecting peer support groups for burnout. And this is how you can use different parameters, only English articles, only those articles which are related, systemic reviews are there, only that. Or you want to find in age position, you limiting it to articles not on young children but yes. Then you could have clinical queries or something more specific, topic specific query which is there, that can be used. So specialized queries can also be put in. So limit your search. So searching which should be limited so that you can read it. So here you can find that you are doing it on cohort studies. So you pick up cohort studies. So you want to learn on vitamin D. So vitamin D, insulin resistance, and the cohort studies. If you do, then you will get the articles exactly the one which you want. That will be displayed right in front of you, and you can easily see it. So this is how evidence base helps you out. It is not blind reading. You are reading only specifically the one which you want, not anything else. So you are not wasting any time. Now the display which is there, when you put an initial query which is there, pain and sleep disorders, you will get more than 5,000 articles here, as you can see here. on pain and sleep or disorder. Now when you start using say all fields, then you will be able to narrow it down to what you want. Now it could be by author. So if you just write Modi, then you will get all the Modis who have submitted their can be done. So and then when you write something specific, then you will write only those which where you need to select. So if you want to go and select according to the journal, you can do it on the journal. So when you select Modi, you will find that articles coming, and if you see here, there are more than 1,000 articles which are there, and when you narrow it down to something specific like forensic or age estimation, if you write, then the article, my own article, you will be able to see it very clearly. From the journal also you can select a journal, and also can be done. So single citation manager is one where you know a single citation, you know the entire citation. Then evidence the PubMed will help you locate that, and you just select that. So instead of going through so many articles or bibliography, you will go directly to the article which you are interested in. Now mesh terms, as I said, it will come down as a drop down. If you just write smokeless, everything related to smokeless will come, that whether it is chewing tobacco or whether you are using anything, snuff and everything of that. So there you can start selecting, searching exactly the one which you want, rather than go for so many articles together. You can just go to a specific article which you are interested in. So there are a lot of options which you are having, whether it is drug effects or whether it is etiology, whatever you want to, or microbiology, or whatever you want to do, you can just select that. So only articles related to that will be seen in the mesh. So that is the importance of using mesh in your search strategy, because it will limit the entire thing to something which you are really interested in. Most of the times PubMed will give you only the abstract, but on the right hand side you will have MDPI and PMC. If that is available, then the whole article also will be available, and you will be able to download the PDF also from MDPI or PML. So that is possibility is there. Now, if you have, let us see how limiting caries is done. If you are having caries, then you have more than 6,500 articles which come on caries. So you need to specify what in caries you want to do. So you write prevalence. Now, when you write prevalence, then it is limiting themselves to 1,777 articles. So this is how limiting will have to be done. Then suppose if you want to include fluoride in that, so dental chloride and fluoride, then you have about 1,175 articles which are there. Again, it is gone a little less. Now the next term which you put, that is more important. So if you have put on clinical trials, if you suggest only clinical, so all the articles which are reviews articles and all will go away, and you will get only those on clinical trials. And if you randomized control trial, if you click, then you will limit yourself to only 709 articles. So you have reduced from that. Then if you randomized control trial, if you do, then you will get only 483 articles. This is how you keep on reducing by putting limits. And of course, if you add fresh only free articles only, because you don't want to pay for it, then it reduces to 39 only. And then if you want to go further, and if you want to still reduce it, then you go for systemic review and free articles, then you get only 20. 22 is a manageable stuff. From 5,000 you have come down to 22, and you can easily read those 22 and find out which one is best suited to. Through glancing only you will be able to do. Now let us have an exercise. Patient has got a fixed partial prosthesis, but cannot stop the smoking, and that is why there is a chance that this will change. but she is concerned that Food and Drug Administration report asking that antibiotics should not be used, and the dentist wants to use antibiotics. Now, when the doctor has the periodontist has asked, the patient has come back to his original dentist. So a PICO is done, and you lay it down according to the PICO standards, which we have already covered it. So you have the PICNO already written down. The question is already focused, and now you have to convert that into keywords, because the keywords is what you are going to do that. So when you write periodontal disease, you are getting 77,000 articles. That is the first thing we will put in your listing. Then in brackets you will write this and doxycycline, and see, you are getting only 6 articles. There are only 6 articles which have discussed doxycycline use in periodontal disease, and 6 articles reading is not very difficult at all, and that is what exactly we want to find out of that particular patient, for that particular patient. This is how limiting your articles comes into picture. And then when you go through that, you will find, if you add the word reduction of the recession, then there is only one article which is doing exactly the same. It is dealing with doxycycline and periodontal use and reduced, and the results are that it has got no use. Doxycycline should not be utilized. That is the result of that particular article, which shows that conclusively that doxycycline has got no role to play as far as stopping of recession is concerned. So whatever the periodontist thinks, the doctor will say. Now EBSCO is another which is commonly utilized. It has the same methodology as PubMed. You have to put a search item, but it has got other features which are also there. So suppose if you are putting it on post-surgical care, you will have so many articles which are coming in. And if you click on any of the article heading, the abstract will be seen immediately. Suppose if you add additional terms like you have in PubMed Advanced Search, this has on the front page itself. So EBSCO is a little more easier to use than PubMed. So you can use full text. You can go for publication type and article. Then you can review an article, or whether you want to have clinical query. All those things are already inbuilt in that. The age, what is the kind of subject it is there, publication type you want, whether it is animal or human studies, whether it is clinical queries or what journals you want to study. So all the age, disease subject, publication, animal research, clinical query and citation, all these are different methods by which you can hone in to your article which you are interested in for your patient purposes. Where you can click on whether the full text whether you want abstract also, whether it should be only a research article. You can search elsewhere also. You can write the author name if you want to, if you know specific. If you don't know other languages, then you can write only English language. So this way, different methods can be utilized to do this. The subjects can also be selected. As you can, there is a drop-down menu which comes when you click on subjects, and you can subject which subject which you want to do. So for example, suppose if you want to Medline, so from EBSCO also you can go to Medline and you get all the articles depending on that. The other things which are there, again you will be able to limit your articles to the one which you want. The most important thing is there are ABM reviews also available. So if you just tick mark that, only those articles which are evidence based in nature will be seen to you. So these are the different ways in which if you want to limit the number of pages also you can do. Then publication types, whether it is a book or that can be utilized. And whether the PDF full text is available or not, that can be done. Then you can use Boolean queries, so select on according to Boolean queries and or not. All those things which are used in PubMed can also be utilized in EBSCO. So you can get the articles which you are in. The most important thing is that you can select different material. Abstract you can select, subject terms you can, author you can select. That can be done from the drop down menu also, or there are boxes available and you can just tick mark on the box, even that will do. So there are two, it makes things easier for us to search. And the articles which are comes in alphabetical order, so you can just keep on the authors will be in alphabetical order. You can do image search in EBSCO also. So if you are not interested in the full article but you want to see the images only, then image search can also be do, and that can also be done. There is a feature called as Ask the Librarian. So if you are stuck at some place, then put a query question to the librarian. The EBSCO will reply back to you in no time, and you will get the solution to that. Evidence-based care sheets are available. So if you click on the care sheets, there are various topics on which evidence-based matter is seen. And as you can see here, that also comes in alphabetical order. And you can see there are so many different subjects on which an evidence-based case sheets are available, and helps a person, especially NOACs. If you want to know only on diabetes type 1, then if you just click on that, only those articles which are on diabetes type 1 will come. As you can see here, the type 1 diabetes, the article is easily seen. So go ahead with your PICO worksheet, go ahead with your different alternative words which are there, and then you can go ahead and search, and that is where